All right, this is my second exam, video exam for nursing 530. This is the second assessment exam. I would complete high eye care when I walk in the room. I would introduce myself to my patient, and then from there we're going to start right into the musculoskeletal exam. The first thing I'm going to do is I'm going to test range of motion for the cervical spine. I'm going to palpate first, so if it's okay for me to touch you, I'm going to palpate. I'm going to palpate the neck, palpate the cervical spine. I'm feeling for anything that might be outside of what could be considered the midline standard cervical spine. I do not feel anything at this time, so I'm going to ask the patient if you can turn your head to the left for me. Okay, turn your head to the right for me. Okay, if you can look down, and if you can look all the way up. Okay, now if you can just rotate your neck for me. Yes, yes. And then once to the left. Okay, perfect. Now, if you can push your head, if you can push against my hand, okay, and if you can push against this hand, okay, and if you can push against this hand, okay. Now, if you can push to the back, okay. I believe that everything has good range of motion, and strength is 5 out of 5. We're gonna move from there to the shoulders. The first thing I'm gonna do is have her push up with her shoulders against my hand. Okay, I've just done my check also for the cranial nerve 11. Now we're gonna test the mobility of your shoulders. For this demonstration, I'm only gonna use one shoulder. So if you can allow your arm to fall next to you, perfect. If you can push your elbow away, like towards my head, perfect. If you can pull your elbow in, okay, perfect. Okay, if you can lift your arm up, straight out, lift it up, okay, perfect. Now, if you can push your elbow back for me, push, 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 okay, perfect. Now, I want you to make an entire rotation with your shoulder. Same arm, yep. Rotation to the front, far back as you can come, and then rotation to the back, okay? All right, and you can relax it. And if you can lift your arms out as well, okay, down. Okay, patient has great range of motion in shoulders. Good flexion, good extension, good abduction, good adduction. Okay, now we're gonna move down to the elbow. Okay, now if I can have you flex your elbow and extend your elbow. Okay, now I wanna do the ulnar and the radial. Perfect. Turn it over, okay. So patient has good strength in the elbow. Now what I want you to do is, if you can face your palms up to the sky, straight out like that. Okay, push my hands up, okay, and push my hands down. Okay, perfect. 5 out of 5 strength. I would say good, good pronation, good supination. Now we're gonna go to the wrists. Okay, if you can flex your wrists towards you and extend your wrist away from you. Now, if you can just roll your wrist inside, roll your wrist outside, okay? Now, with just your wrist, push my hands down. All right, now push my hands up. Okay, perfect. I would say 5 out of 5 strength for wrists, good mobility in the wrist as well. Now we're gonna do fingers. If you can extend your fingers as much as you can, okay. Contract them as much as you can. Okay, and just kind of wiggle them. Okay, wiggle, 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 wiggle. Okay. Now, if you could give my fingers a squeeze, if you grip them, you can grip them in your fist. Okay, squeeze them as tight as you can. Tight, 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 tight. Okay, perfect. Good physical strength in the hands, 5 out of 5. Good extension, good flexion in the hands. Now, from the fingers, we're going to move down to the hips. Okay, now what I would like you to do is sit up really good, really nice, and put your feet flat on the ground. If you could scoot up a little bit. Okay, perfect. Now what I want you to do is raise your, well, if you can stand, actually. If you can raise your knee, okay, and if you can raise your other knee, okay. Now if you'll sit back down, okay, can you lift your right leg up for me, straight? Okay, down. Can you do the same with your left leg? Okay, down. Now, if you don't mind, if you could spin and lie back for me here, I'm just gonna further test your hip flexion. And be careful with your head. You wanna scoot down a little bit? You can if you like. And what I can do is, you lift your feet up, so we can simulate a hospital bed here or examination bed here. I'm going to check your hip flexion, okay? All right, so I am testing hip flexion. I'm feeling for any kinds of clicks, catches, or pops. Now, what I'd like you to do is push against my hand, well, this hand. Perfect. All right, now, I'm still testing for any kinds of deviations from what would be considered the flexible norm. She has good flexion, good internal rotation, good external rotation, good flexion, good extension. I would do the same exact exam on the other side. Now, if you could turn and sit on the edge for me. Yeah. All right, now I'm gonna test her knee flexion. All right, so for the knee, what I'd like you to do is brace out with both hands on the side, just to make sure you got a good base. And if you could come to the edge a little bit, okay? Now I just want you to flex this knee against my hand, perfect. Now flex your calf against my hand, okay, perfect. Now if you can extend your knee all the way out for me, okay. And if you can stand up, and you can bring your knee back as far as you can. Without holding it.
Okay.
Okay, that's perfect. I just wanted to check flexion and extension. We can sit back down. Knees look good. Full flexion and extension. 5 out of 5 strength. All right, now if you could put your leg here for me. All right, now we're going to test the ankle. We're going to test for supination, pronation, inversion, eversion, as well as strength. So if you can press down on the gas for me. Okay. If you can lift up for me. And then just lift up as high as you can, all right? Okay. Now, if you can flex inward for me, flex outward for me, and then just give it a full rotation from the inside and from the outside. Perfect. Okay. Good flexion, good extension, good internal rotation, good external rotation. Let's see. Knees are good. Knees are strong. Did strength testing for the ankles. I think the last thing that we have to do for musculoskeletal is the spine. So if you can stand up for me one more time. What I'd like you to do is stretch all the way back without hitting your hands on the ceiling fan. Okay. And then stretch forward, kind of let your body curl over. Okay. Now if you can come up in a good Billy Blanks position, if you can twist to the right, perfect. And then twist to the left, perfect. Okay, you can sit. So good rotation. Good extension, good flexion. The spine looks intact. I'd say 5 out of 5 strength because she's able to manage her own body weight. Okay, so I'm gonna move from there I'll just move this back. I'll move from there to the neuro exam. Okay, so the first part of my neuro exam, I want to be able to assess your cerebellar function, and I want to be able to assess your cognitive and intellectual function. So the first thing I'm going to ask you to do is to spell Duke backwards.
E-K-U-D.
Fantastic. Now, I want you to remember this statement. Let's go Duke. Okay? So while you're remembering that statement, I want you to use your hands to touch your nose. Keep your arms extended. Yep, and just kind of come in and out, come in and out, come in and out. Doing great. Come in and out, come in and out. Okay, you can stop that. You can put your arms down. Now, there was a statement I asked you to remember. What was that statement?
Let's go Duke.
Fantastic. So you demonstrated cognitive and intellectual intactness, and you demonstrated cerebellar function, and you've also demonstrated that your cranial nerves 9 and 10 are also intact as well. So for judgment, to demonstrate judgment, I want to ask another question. If I were to buy you a UNC jersey, what would you do?
Light it on fire.
Fantastic. That is fantastic. So moving from there, I'm going to go to the test of the cranial nerves, the rest of the cranial nerves. The first one will be the olfactory nerve. So if I can have you close your eyes, I'm going to ask you to smell this and tell me what you smell.
Smells citrusy.
Okay, that's correct. It is Burt's Bees Sweet Mandarin, so that's citrusy. Okay, If you can keep your eyes closed for a second. And if you can open and tell me who this is.
Fixed devil.
It's the blue devil, that's correct. So you're able to track, and obviously that's what I would use for a minor, because it may be more difficult for them to focus on tracking, which is the actual exercise we're about to do to test visual gaze by confrontation. But that I feel like is a great way to get minors to pay attention. But for adults, I'm going to do something a little different. If you could sit here. Okay. So it's good to be eye level when conducting this portion of the exam. So what I will do is I will have you cover your left eye. Okay, now I'm going to flash one of my fingers and you just tell me which finger you see flashing, okay? Perfect. Okay. 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 Okay, fantastic. So cranial nerve 2 is intact. We're gonna move to 3, 4, and 6. All right, a little wider of a visual field. I would like you to follow my finger without turning your head, okay? Okay, cranial nerves 3, 4, and 6 are intact. If you can have a seat back here for me. That's back. All right, so the next thing that we want to check is we want to check cranial nerve 6. Can you clench your jaw for me? Okay, fantastic. Cranial nerve 6 is intact. I don't see any droopage. I don't see any sagging when she clenched her jaw, so everything appears to be intact. The next thing I will check is cranial nerve 7. If I can have you just kind of raise your eyebrows for me like you're confused, or like you're trying to say, yeah, you know? Perfect. Cranial nerve 7 appears to be intact and functioning properly. The next cranial nerve I'd like to test is the cranial nerve 8. So what I'm going to do is I'm going to stand in different places around you, and I'm just going to whisper, and you just tell me the word I say, okay? All right. Well, you don't have to whisper. Okay.
6.
Okay.
5.
Okay. I'll come over here.
7.
Fantastic. All right. So that was cranial nerve 8. Cranial nerve 8 is intact, so that's perfect. All right. The next cranial nerve I will antagonize is 12. If I could just have you stick your tongue out for me. Okay. Tongue is midline, and she's able to stick it out. So cranial nerve 12 is intact. Next, I'm going to go to the reflexes. So, for reflexes, I'm going to check your bicep, I'm going to check your tricep, and I'm going to check your brachioradialis. So in order to do that, I'm going to place my thumb in the AC to check the bicep, right over that tendon in the AC, and I'm going to give you a little tap on the bicep. It would be a lot easier to do this directly over your skin. You can just relax there. You feel anything? Okay, because I couldn't really tell.
You want to take my arm?
No, it's fine. And then I'm gonna do the tricep. If you just let your arm hang freely, I'm gonna put my thumb here. Well, let's just. Tricep is intact. And I'm gonna do the brachioradialis, which will be if you just allow your wrist to sit here. I'm gonna put my hand in the same place, and I'm just gonna tap it with the hand right here. Actually, I'm sorry. That's the bicep. I leave my hand here, but in order to engage the brachioradialis, I'm going to tap here. And it's actually a pretty good, that's a pretty good reflex. All right, so my reflex tests are done. I completed my reflex tests. Now I want to go to the physical portion of the test that requires you to stand, and it's going to require you to walk. So you're going to walk in a straight line, heel to toe. So you're going to literally walk from heel to toe. Yep, and if you could just walk heel to toe straight at the camera, and you can spin around, and you can walk heel to toe back to your seat. Okay, perfect, and you can have a seat. And so from there, we're going to move into the final portion, which is the abdominal portion. This is the portion I'm the most scared of. So we're going to move that over there. I'm going to have you lie on your back again. I'll move this here. Don't fall. Please don't fall. All right. So to start off my abdominal assessment, I'm going to start off by looking. The first thing I'm going to do is inspect. I want to inspect for contour, for symmetry, for shape. I want to inspect for any types of asymmetry at all that I might notice. And I'm going to do that from the side level. In a normal clinical situation, I would raise the bed up as high as I could raise it up to avoid, going on the ground, obviously, but I'm going to inspect it from the side level. And I'm going to get down at level on the side so that I can see across and I can clearly see the abdomen, and I can tell that there's no malformations or anything of that sort. After observing or inspecting, I'm going to move to auscultation. So for auscultation, I'm going to come around so you can see where I'm auscultating. I'm going to put on my stethoscope, and I'm going to start auscultation in the right upper quadrant. I'm going to move from there to the right lower quadrant, and then from there, I'm going to go to the left lower quadrant, and then from there, I'm going to go to the left upper quadrant. And I'm going to spend about 1 to 3 seconds in each quadrant. Excuse me. I'm listening for bowel sounds. I'm listening for any types of sounds or anything that I might hear that might indicate either normal or abnormal function of the bowels. And I'm also going to continue to inspect and observe as I'm doing so. Now that I've done that, I'm going to go ahead and auscultate the bruits. I want to make sure that if there are bruits present, that I can auscultate them and I can recognize them. So in order to auscultate the bruits, I'm going to have to know my anatomical landmarks. To find the aortic bruit, I'm going to be a couple inches above the umbilicus midline. So I'm going to auscultate, if this is her belly button here, I'm going to auscultate here for the aortic bruit, and I'm going to listen for anything that may be a telltale sign of an aortic bruit, inappropriate whooshing, any kind of bounding pulses, or anything that sounds disproportionately superficial or just inappropriate in general. I'm going to go from there to the iliac bruits. That's going to be bilateral upper quadrants. I'm going to listen here as her upper quadrant is here, and I'm going to listen here as her upper quadrant is here on this side. So that will be my iliac bruits. For the renal bruits, I'm going to be in the lower quadrants on both sides bilaterally. I would listen here for the renal bruit on this side, and I would listen here for the renal bruit on this side. For my femoral bruits, I'm going to listen in the groin. That would be here on this side, and that would be here on this side. And I'm going to listen to make sure that I can't pick up on any inappropriate sounds or breathing circulatory patterns in any of those 5 locations. Okay, I've auscultated for bruits. I did not hear any bruits. From there, I'm going to move into palpation. So I'm going to start palpation in the upper right quadrant, and I'm going to palpate gently first, and then I'm going to palpate deeply, and I'm going to palpate just by feeling, seeing if I feel any structures or if I notice any tympany, or if I notice any rebound tenderness, or just tenderness in general right now. And I'm gonna ask my patient, does this feel uncomfortable?
No.
Okay. Does this feel uncomfortable?
No.
Okay. Does this feel uncomfortable?
No.
Okay. Does this feel uncomfortable? And I started with left upper quadrant, right upper quadrant, right lower quadrant, left lower quadrant. I palpated both gently and deeply in all 4 quadrants. I didn't feel anything that that would catch my eye or make me think that something was wrong. I didn't feel any scattered dullness or anything that would indicate something going, something that could demonstrate an illness or injury. From here, I'm gonna percuss the liver. In order to percuss the liver, I'm going to, in order to percuss the liver, I'm gonna percuss the liver span. I'm gonna start, on this side to percuss the liver span, and I'm just going to percuss down to see if I can feel the level of the liver. And I would do the same thing with the spleen. I would percuss the spleen. Drawing a blank. I would percuss the liver. I would percuss the liver from the level of the, I would percuss to estimate the liver span and the liver height. I would also do the same thing with the spleen. Yes, I would do that. And then I would check for aortic pulsation. The same place that I checked for bruit. And I would check to see if there was any forceful not contractions, but forceful pulsations at the aorta, which is a few inches above the umbilicus midline. That concludes my assessment.